Go ahead and get started. It's 10 o'clock straight up. My name is Wes Studdard. For anybody that doesn't know me, I'm the chairman of the board of the chamber this year and vice president over at Bluebonnet Motors. Next to me is Natalie Rougeux. Natalie is the CEO of Rougeux and Associates, employment attorney in town. And she was also past chair of the board probably 3 or 4 years ago.
Yeah, it's been a while now.
It's been how long it's been. So what we wanted to do this morning, and Phyllis from the chamber helped us put this together. Chester is also running the Zoom for us, but we wanted a quick recap of what happens when you have COVID in the workplace. And so I'm going to take 10 minutes and just kind of walk you through what we've done at Bluebonnet at our different dealerships. Then I'm going to give it over to Natalie to go 10 minutes through the legal aspect of everything that's happening out there. And then we've left 10 minutes for questions, and we'd be happy to answer them. Also, I'll tell you, we're going to go ahead and mute everybody at this time. If you do feel like you want to ask a question right away, you're welcome to unmute yourself. If you can wait to the end, we're holding 10 minutes for question and answer, or you can put a question in the chat and we'll try to catch that as we're moving along the process here. So with that, let me just get started. I want to tell you, first of all, the history. It came in March, and what a change for every one of us and how we had to operate going forward. In April, they had the stay-at-home order. For us at our business, we went to half staff, so people worked 1 week and then they were off the other week, trying to figure it out. And then May we came back full. We were essential business, and so they said you can stay open. So we had to just make our way through it. We were putting up plexiglass screens at all of our touch points to make sure that our folks were safe. And it was interesting to see. We had our first case. I guess it was first part of April. It was one of our salesmen. His son worked at a hospital in Seguin. His son called and said, "Hey, Dad, I just found out I've got COVID." Dad came into my office and said, "Wes, my son just called. He lives with us. He's got COVID. What do I do?" So that was our first case. That was the first week of April. He was with a customer. We immediately quarantined our employee, sent him home, said, "Okay, we're going to need you to get tested." We communicated with the customer that was there and then with everybody at the dealership that, okay, we've got a case. And then what do we do? And that was the great big question. Fast forward a little bit, our employee did end up getting it after he got tested. He did end up spending a few days in the hospital, not on a ventilator, but in the hospital and then back out. And he's doing fine now. So that was April. Move forward to May, and my experience that was in a home spread. My son, who's in his 20s, came in Memorial Day, went out with 10 people downtown New Braunfels, and 8 of 10 of his friends got it. We had dinner with him the Sunday night. The Monday morning, he said, "I don't feel good." We said, "Go get tested." And then we found out he had it. So we had him quarantine, isolate up in his apartment in San Marcos. And he did fine coming through it, minimal symptoms. My wife and I and my daughter, we all tested twice the following week and had negative tests. So we never caught it, even though we had dinner with him the night before he tested positive. So I just tell you that to give you some examples of what I've seen, but I want to move quickly to our company policy and what we did. So in April, we said, okay, we got to get our hands around this. We know CDC website's got a lot of information, but we need certain things just for the dealership. And so we came quick with, all right, we're going to take everybody's temperature when they come in every morning. We're going to ask them how their symptoms, if they have symptoms, how do they feel? And then we've also added to that, we're going to ask them, is there anybody within your household that's sick? Because what we found out over this last 3 or 4 months is most of the spread occurs from a household and then somebody brings it to work with them. So we've got to stop it before they even get into the place of business. And so those 3 things go a long way. Take the temperature, ask how the employee's feeling at the start of the shift, and then ask, is there anybody within the household that is sick as well? When you do that consistently, and we track every employee daily, a temperature, and we can see a spike in their temperature because we've got it for the whole month going along, and then you also get an understanding from them as you talk to them, hey, maybe they don't feel as good today. So that's a great way to head it off. That's part of our first policy. Then, what ends up happening when somebody does come to you and says, well, I've been exposed. Well, then we go to the quick, okay, what have you done? Who have you been with in the last 6 hours? Within 6 feet, in the last 48 hours, and within for a time of 15 minutes or not. So we call it 6, 15, 48. 6 feet, 15 minutes, 48 hours. And try to find out who all of you had potential exposure with. As soon as somebody tells us that they have symptoms or they've gone and gotten tested, then we get that result back from the testing center. We do the 15-minute tests. Texas Med Clinic's a great one. We've used a few of the other small ERs that are around to get tests, because testing is problematic too. How quick can you get a result back? We've had some, at the onset that took a week to get, and that's really problematic, because then do you quarantine the person or do you not quarantine the person? So we go through the interview with them. We ask the person that has the symptoms, who have you talked to? And then we go out to everybody around them and say, who have you talked to? Now, when we had the salesman that had it, he had passed off some keys and talked to our receptionist. And we had 5 people at the time that our first employee said, okay, my son has it, and now I'm going to get tested. We had 5 people that wanted to go get a COVID test. We said, well, you can do that, but based on were you around them within 6 feet for 15 minutes or more, and none of them could say yes to that, but they wanted to get tested. So we said, fine, go get tested. They got tested, and they got negative tests. But as soon as you get tested, then the doctor's going to tell you need a quarantine for 14 days. So they all came back and said, well, because I had exposure, they say I need a quarantine for 14 days, but did you really have exposure or not? And so as an employer, we've got to come in and say, okay, what did that exposure look like? Was it within 6 feet? Was it for 15 minutes or not? I can tell you the worst case of exposure for us is driving in a car with somebody. We had 4 people that drove to Bernie in the same cab of a pickup truck. 3 of the 4 got it. And this was at a time before we had face coverings. Just last week, we had another dealership. 2 people were driving. 1 guy had it, didn't know he had it. Another person riding with him, and now that other person has it. So in a car, it's recirculating air. You're very close. You're within 6 feet of each other, probably for 10, 15 minutes. Good chance that it's going to spread within a car. So we'll certainly wear face coverings within the car. Then we go to our policy, and I've got another one that we can share. This is a tracking spreadsheet that we use. And what we found is, as people are coming to you and saying, okay, either I have symptoms or someone in my household has it, or I might have been around somebody, the days kind of start getting weary and you're not sure, well, how many days have you been out and when did you really have the exposure? So we created a spreadsheet that first of all says, who's positive, and we put their name on it. And then we've got below that, who had close contact and needs to be quarantined for 14 days. And then below that, we have maybe close, maybe not. So we're going to go to a different protocol. And then we have who says that they don't feel good and they're out tested. So we're measuring this people. Across the top of the spreadsheet, we have the days of the week. So it's Friday, Saturday, Sunday, Monday. And we're going to try to get this spreadsheet up there just so you can see it. And so it gives us real clarity, because then you look back 3 or 4 days later and you think, well, when did Bill tell me he tested positive? So in this case, Bill tested positive on Sunday, August 9th. So then we said, okay, Bill, you're going to be out for 10 days, and then we want you to take a test on August 19th. Once you get those results, that's today. We actually have a guy, his name's not Bill, but that's taking testing today. And then if his test is negative, then we're going to let him come back in. That's not a CDC requirement, that if you go the 10 days after you were positive that you take a test, but we felt like that was important. Sam is another guy in this example, the quarantine. He said that, you know what, my wife has it. She's at home. I don't have it yet, but what do I do? Well, Sam, you're going to have to stay at home with her in quarantine because that's close contact. And CDC has great guidelines on that. But you're going to be out for 14 days from the time that she had her symptoms, and then you can come back. At that time, we don't require him to have a second test as long as he doesn't have any symptoms. And then we have the close double test scenario. So Marty was around Bill that tested positive, but not really for 15 minutes. He passed him in the hallway, spent a little more time with him, and thought, maybe I have it. We say, okay, this is Bluebonnet's own protocol. We say, we're going to quarantine you for 3 days, 72 hours. We want you to take a test. As long as that's negative, we're going to quarantine you for another 72 hours, take a second test, and if you have 2 negatives, then you can come back to work. So that's how that scenario looked. And then the bottom one, testing with symptoms, Karen came in and said on Thursday, hey, I've got symptoms. We said, okay, stay home. We don't want you in the store. Get a test. She had it on Friday the 14th, and now we're just waiting for when the results are coming back. So that's the key to that. The P is positive, the Q is quarantined, then you have a positive symptoms, and then you have waiting. So simple spreadsheet. I highly encourage you. At one time, I had about 30 people between, not 30 positives, but about 30 people between quarantines and double testing and symptoms, and it gave me great clarity on, okay, here's what I need to do. I will tell you that the gentleman that was riding in the car, the second example, he tested negative after the first 72 hours, but he tested positive after the second 72 hours. So there is a viral load time that you got to be aware of. And so the real thing is you talk to the employee, find out, where they've been, who they've been around, and then have the conversation with those they've been around. So those are real life examples from what we had within our operation. So now I'm going to turn it over to Natalie so she can give you the legal aspect and correct me on anything that maybe I said.
You're great, and I'll feed off of a couple of those things. So again, this is very rapid. To talk about COVID law would take a lot longer than 10 minutes, but I'm going to hit the highlights of what we're seeing. First and foremost, the FFCRA, which is the Family's First Coronavirus Response Act, is still alive and going. And there's two issues right now. So one of them is what Wes just talked about. If you have less than 500 employees and you have an individual who has symptoms and is seeking a diagnosis or has been actually tested and tested positive, they have up to 80 hours of paid sick leave that you can get reimbursed through tax reimbursements. They also, if they're staying home and taking care of somebody with positive testing, or they're taking care of kiddos whose school or daycare or place of care is closed, they get 2/3 pay for either 2 weeks if they're caring for a family member who's tested positive, or another 12 weeks if they're taking care of kiddos. I mention that because right now, as we all know, schools are opening, and the biggest issue is in some of our jurisdictions, and all of our employees are kind of spread out everywhere. Some jurisdictions are allowing the employee or the parent to choose whether they're going to have their kids in class doing instruction or keeping them home. So one of the major questions that we've been getting almost daily lately is, if I have a parent who chooses to do schooling at home, do I have to pay them the 2/3 pay for 12 weeks under the FFCRA? And the answer is no. It's only if the school is actually closed. So for example, Harris County that is not opening their schools, if you've got employees that are spread out, for example, those employees would be entitled to FFCRA paid leave, but the employee who chooses to do homeschooling versus in-class instruction would not be. So I think that's an important aspect of the FFCRA. Also, with folks who have tested positive or are caring for somebody who has tested positive, you want to think about the Family Medical Leave Act, and that applies to any employer with 50 employees within a 75-mile radius. And the Department of Labor has definitely said that they consider COVID to be a serious health condition that would qualify employees for Family Medical Leave Act. So if Wes has an employee who is at home recovering from COVID who tested positive, they should be on FMLA, but that is unpaid FMLA. That is traditional FMLA, except for those first 2 weeks, which fall under the FFCRA. Another thing that's important, especially pulling off of what Wes just said, when we send folks home and we require them to quarantine, if it's 3 days or more, they can apply for unemployment. So don't be surprised if you have an employee who you've sent home for a quarantine and you get an unemployment notice. It seems strange because the employee has not been fired, but they have that right because if they're unpaid. Now, if they're being paid under FFCRA, different, but if they're unpaid, then they can apply for unemployment. What you need to do as the employer is make sure that the unemployment claim is clear that it is due to COVID, because if it is due to COVID, then you will not have the charge back on the account for that unemployment claim, which will undoubtedly be granted and quickly granted. We also still have folks transitioning back into the workplace and doing some alternative arrangements. And some of our clients are reducing hourly pay or even reducing salaries just so that they can keep people employed while they ramp up as things start to get a little better. With hourly employees, if you reduce their pay by 20% or more, they also can file for partial unemployment. Again, if you get one of those, just make sure that they're saying COVID, right? So they're back at work, but they're not full, at their full pay because of COVID and us trying to transition into that. For salaried, it's different. If you reduce their pay by 20% or more, they have the right to resign for good reason and file for unemployment to get full unemployment. However, if they do not resign and they remain employed, so long as you're paying the $684 a week that's required under the Fair Labor Standards Act, those employees have essentially accepted their new arrangement and they are not entitled to unemployment. Also, look for fraud and look for employees who are fearful to come to work. So we talk about COVID in the workplace. Even if you have a workplace that has not had any COVID exposure, no outbreaks, what we are seeing repeatedly right now are employees who are emailing or calling their employer and saying, I'm just too scared to come to work. And so what you need to do in that situation is fight back on that and explain, your protocols. For example, Wes has a wonderful policy that they have at Bluebonnet that explains exactly what they do to check temperatures, to track, how they quarantine people, when they quarantine people, their cleaning protocols, etc. You want to make sure you inform the employee of that and reiterate that you feel that is a safe environment. And if they continue to refuse to report to work, then you can consider that a resignation. I would recommend in that situation, you fight that unemployment claim if you get it. However, I will say in my experience, the TWC is granting a lot of those cases and still not charging it back to the employer, but we'll kind of have to see where that goes. We are seeing, I have 3 discrimination claims right now related to COVID in the workplace. And these were employees who were sent home because they had symptoms and something happened in the interim and they ended up being terminated, whether because they discovered misconduct or there ended up being a reduction in force, which are 2 of my cases. And the EEOC, the Equal Employment Opportunity Commission, is very hot to trot on these cases. They feel that sending somebody home because they have symptoms and then firing them within a short period of time looks like you fired them because you were afraid they had COVID, which is what is called a regarded as disability claim. So it's a form of disability discrimination. So when we're sending people home, we're sending home with symptoms. If you find yourself in a situation, well, gosh, while they were out because they had symptoms, we discovered some misconduct, et cetera, you want to think very carefully about proceeding with a separation in that situation. You also need to consider accommodations for people with disabilities, not COVID, but that can be impacted by COVID. So right now we have folks that are saying, I'm high risk for COVID because of a medical condition. The EOC absolutely requires that you enter into the interactive process to discuss with the employee what you may or may not be able to do. Can you allow them to continue working from home? Can you have them work a different shift so they're not exposed to people? Are there extra cleaning protocols? One of my cases right now with with a high-risk individual due to a disability, we've given her a private office in a completely different area of the building, for example. So she really literally doesn't have to have contact with folks. So, don't discount those people who happen to be high risk because of a disability. That's still a disability that still requires us to accommodate. Now, if they live with somebody who's high risk, that's a different story. We don't have to accommodate family members or accommodate an employee who has a family member. So, be careful of that. The most recent one that I had is an employee didn't want to come to work because she was being very conscientious. She happens to live with 2 high-risk people. One's a police officer and one works in a hospital. And so she didn't want to come into work because she might potentially expose coworkers. So that's not a disability accommodation issue, but it's still something that you want to have an open dialogue about. So be careful of that. I would say the ADA, Americans with Disabilities Act, is one of our probably most difficult things that we're dealing with in our law firm right now. Also, just yesterday, I got my first OSHA complaint for COVID. It's basically an employee complaint, I don't want to come to work, I don't think it's safe. And we were working with that employee. When I say we, my client, I always say we when I talk about my clients, but my client was working with that employee to get the safety protocols in place to make this employee feel comfortable. Well, this particular employer runs on contracts, lost a contract, and that employee was on that contract. So they had to lay that employee off. And that employee is now saying, you laid me off because I complained about an unsafe work environment, which falls under the whistleblower and retaliation part of OSHA. So again, if you have employees who are expressing concerns about the workplace and COVID and how you're reacting to COVID, you want to be very open, tell them exactly what you're doing, and then just be careful on the back end that we're not falling into the retaliation trap. So.
Wow, a lot of information. That's good stuff. All right, so we've gone 20 minutes nonstop, and we want to open it up to anybody that might have a questions. I do see one on here that is saying, have you seen recent guidelines from CDC stating a person can keep testing positive for up to 2 months after recovering from COVID? They seem to now discourage testing for deciding whether you come back to work or not. And that's from Lilia. Thank you, Lilia. And she is a partner with Natalie, so maybe you ought to answer that one, Natalie. Now, I have seen that, and that certainly is problematic. We haven't run up against that yet. So anybody that we've had that had COVID, we have been able to get a negative test before they come back. And let me tell you, it really makes the rest of the workforce feel comfortable if you can say, hey, this person is now negative.
Yeah. Yeah, I mean, that is true. What we've been doing as a result of that is telling employees to quarantine and then test if they develop symptoms, because of a couple of things. And I think it's different for every employer, and I think each employer has to make this decision. But the other problem we're having is somebody is actually positive, but they test negative, and then you see you are retesting, but a lot of folks don't do the retest. And so you come back into the workplace with a negative test, but you actually are positive. Yeah. And so some of our clients are taking a position of stay home, and as long as you don't have symptoms for 14 days, come on back. But if you do develop symptoms, get tested, and then we need that negative test result. Yeah.
And so Paul asked a good question on the chat. What if they test negative, but the doctor says they have it?
For us, from an employment law perspective, we follow what the doctor says.
Yeah, and we're going to go with what the doctor says too. So that's the safe route there.
Yeah.
Disinfecting spraying. So we started that early on. We did some disinfecting. We had some fogging done. Our daily custodian protocol is to spray everything as well. So many pieces of paper around our desk areas that are kind of curled up because they get a little moist every day. We also brought in the UV light. So when we did have a little bigger outbreak, we thought, okay, we're going to try this. This is the blinking light that comes in. Same thing they use at hospitals, the subway in New York, and now they're using it in some airplanes. Seems like that's working pretty well as well. So we've done both of those, but our daily routine is always wiping down touch points throughout the operation, and so that's what we get done.
Marcy. So Marcy's question is, when your employee chooses to get testing just as a precaution that you're not requiring them to do you need to pay them for their time? And the answer is no. If it's an hourly employee, if it's a salary, then yes, you would pay them for their time, because a salaried employee must be paid for the entire week for any week in which they perform work. But if it's hourly, then the answer is no. And then Chris
has got on the and I will tell you, there's some gaming of the apps to get you into an appointment for Texas Med Clinic. You know, how long can you get in there on the onset? And I'll tell you, I've had 3 tests. They've all been negative. But back in May, I was able to get in same day. In June, it got a little longer, where it might take 2 or 3 days, and they got to a point where they wouldn't take you unless you said you had symptoms. But now I'm understanding that you can get back in within a day or so. On our spreadsheet, as we have people that we know are going to need to test in a day or 2 days, we tell them to go ahead and get on there and get lined up for the test so you can get one. I would be careful. I did have one test, and they said you'll get results in a day, and it ended up taking 4 days, and that really becomes frustrating because you're just trying to get a quick result and figure out, okay, how much do I have to quarantine or isolate, and then you're just waiting for another 4 days if you don't have symptoms and you're just trying to verify. So.
And I don't know, some of my clients, their employees have been using the CVS drive-through and the Walgreens as well for testing. So CVS has, right now here in town, they have 2 lines. One's for COVID testing and one is to pick up your prescriptions. And so you can do drive-through testing, and they do it in their vehicle themselves. So that might be something else to look at. And then Courtney, I'm sure that Wes would love your non-moisture spray.
There you go. That's right. Good idea. We'll move down to Amanda. It says, how would you address an employee inquiry about ACT, and we have 25 employees? We don't pay hourly salary if businesses are under 50 employees, right?
I think, if I understand, Amanda, your question, you're asking about the FFCRA, and the answer is no. As long as you're under 500 employees, you must pay under the FFCRA. If you have less than 50, there is an exemption that you can claim, but it's pretty tough. You have to show that paying the FFCRA funds to the employee would render you unable to meet your other expenses and obligations, or you have to show that the employee has such a unique job that you cannot have that employee in the workplace. But keep in mind that those only work if that person is on child care leave. If somebody is actually tested positive for COVID or has symptoms, you really have no choice. So this exemption is very, very limited. And now for your traditional Family Medical Leave Act, for, folks that are not covered under the FFCRA, then yes, under 50 employees, you're not covered, but for the FFCRA, you are covered. And yes, the FFCRA, Blanca, does apply to part-time employees.
All right, and then David, you were asking about advice around not doing temperature checks because of all the other symptoms, and there's a lot of symptoms out there, but I will tell you, we found that our employees like seeing that we're taking everybody's temperature every day, and that's another thing that just makes them feel good. We've put that protocol into the youth leadership graduation that we did as well, so as everybody came into that last week, we did it for the Texas Texan of the Year Award. In a couple of weeks, we're going to put in that same protocol, and we've asked the fire department to come help us with that. And I think it just sets a standard right away that we're doing things to protect everybody. And so I don't see anything wrong with the temperature check.
No, and I think it's one of the greatest indicator of possible COVID. I mean, all the other symptoms, could be allergies, could be, so we want to ask the employees, are you coughing? Do you, having trouble breathing, those things. But the temperature check is probably, I think, your strongest indicator. It does make people feel good. The only thing we're doing, because we're in Texas and some days it's 110 degrees, if somebody comes in and their temperature is elevated, have them go sit to the side, give them a few minutes. I mean, I've even had to do that going to the nail salon where I walk in and I have a fever, but wait 5 minutes and my temperature is normal, and it's just, from coming out of the heat. So I think as long as you're giving that bit of a consideration, I think temperature checks are fine.
And we're using a threshold of 100 degrees, and I think that's CDC as well.
Yeah.
So, and then we do give somebody 15 minutes to cool down if they did come down.
Yeah.
Chris is asking, negative test results, is that enough to allow for an employee to return to work, or do you need a doctor's release beyond that? And we use it because we get the negative result from the med clinic, so to us it's a doctor that's saying that.
We're the same.
Okay.
Yeah, we're the same.
Any other questions? And if you don't want to type one, you're welcome to unmute and just ask the question. I will tell you one thing we did on the onset was we added 4 sick days. Right now, all of our employees had 6 sick days. We added 4, so they had a total of 10. Then through the Family First Coronavirus Act, you have the other 10 days if you are seeking diagnosis. So that's 20 days in total. And then our vacation goes up to 3 weeks, depending on how many years you've been with us. So somebody has, a stretch of almost 2 months if they are to get it and be out for a while. So you gotta, and that makes people recognize that, okay, it's okay for me to say I'm sick, and we encourage them, if you're sick, don't come into the business. Stay home.
A lot of our clients are doing that as well, is providing some paid benefits to encourage folks to be open while monitoring abuse. So for example, one of my clients is looking at, basically, if you're on a non-FCRA paid leave and we catch you through Facebook or elsewise, out tubing or out partying, we're going to cut that paid benefit off. And we have employees actually acknowledge that they recognize that if they're home because they have symptoms or they're seeking a diagnosis, that they have to be socially responsible. Or those benefits could, go away. Marcy raised her hand, but it looks like she just said, what questions do you recommend us to add to the temperature checks?
Well, ours is, how do you feel today? Do you have any of the symptoms from CDC, sore throat, cough, runny nose? And then we ask, does anybody in your household feel sick? Because we want to know if there's a household member that has symptoms as well.
And if you go to the CDC website, there's actually a poster that you can post on your door that has, that basically lists, if you have the following symptoms, you should not report to work. And so I would just, go find it. Marcy, if you can't find it, just shoot me an email and I'll try to find it for you.
And Blanca asked, are we going to send out meeting notes? And we'd be happy to. We can attach what we have and send it out to you.
Well, Chester answered.
Well, Chester said the video will be available.
Oh, got it.
There you go.
And then what training, if any, recommended for employees that are taking temperatures? We just bought a bunch of the it took a while at first to get the thermal thermometers, but we have a whole bunch of them. So we have them in every department, so that there's not an excuse for us that we don't have it. And then it's, you shoot it, and then we tally it each day. We have a log for the employees, and every day of the week we tally what their temperature was.
Yeah, the only guidance on that is the EOC says do not require somebody to take temperatures if they're not comfortable doing so. In other words, some employees don't want to get close enough even to use the little, I call it the little gun. It feels so weird. They point the little gun at your head and take your temperature. But the EOC just says make sure you're not requiring anybody who's resistant to doing that to do that. Otherwise, just tell them what temperature is your threshold, and and how to use the device. And then I think that's all the training you need.
Okay, we have time for one more. It's what are the legal implications if I have a contract and send people to work at another environment and they may not feel comfortable there.
Yeah, that one's tough. I've had that happen actually a couple times already. And so you have the obligation to keep your employees safe. And so if the employees feel uncomfortable at the job site that they're going to or the contract that they're working on, you need to get verifiable evidence. So for example, one of my clients actually had their employee take video of people not wearing masks, not monitoring social distancing, and then we ended up contacting the third party, the contract that we were working on, and entered into negotiations on how they were going to correct that. And I think you have to do that. And if they do not correct that, then you have that difficult decision of, are you going to pull your people off the contract, which could result in a contract dispute, but you're going to have to weigh a contract dispute versus OSHA violation or a personal injury claim if you force people to work on a contract that's not practicing safe practices.
Great. All right, so we're coming to the halfway point, or 10:30, if you will, and we're going to go ahead and call it at that. We appreciate everybody joining us. You can see we had about 60 participants. Thank you so much. I would love to tell you a joke about why they call it the novel coronavirus, but it would be too long because it just keeps going on and on. So thank you for joining us this morning. We will have another one of these coffee breaks with the chamber in about 2 weeks, and we'll have a school superintendent to report to you. So again, thank you. Have a wonderful day. Stay safe, stay healthy. I hope you enjoyed our time here.